everyone, welcome back. I'm Dr. Sarah Keep from By Design Optometry. I'm an optometrist here in Edmonton. We provide routine eye care for patients in Edmonton as well as vision therapy in Edmonton as well. So with me here today is Jenny, so thank you for joining us. We're going to be having a little bit of a discussion about strabismus.
Can you explain further what strabismus is?
Absolutely. So strabismus is a condition where the eyes are not aligned. So basically they're looking at different points, which means images are then focused on different parts of the retina that are not corresponding to each other. Strabismus can result in an eye that turns in or out or up and down, or even an eye that's rotated. The eye turn in some patients is constant, where it's all the time. So you'll notice that the eye is always either out or always either in. It can also be intermittent, where it only occurs in certain situations or when viewing at certain distances. So some patients will only have an eye turn when they look at objects far away, for instance, or only have an eye turn when they're looking up close. Or sometimes they'll only occur when they're doing, visually demanding activities such as reading, or only when they're kind of gazing off into space. So it doesn't necessarily always have to be there all the time. There are different types of strabismus, and each type kind of has a different underlying cause. So the treatment is different based on the type of strabismus, but it can involve anything from the prescription of glasses to prisms. Sometimes we'll do special occlusion to treat it. Vision therapy is often quite effective, and sometimes it does actually require surgery as well. Yeah.
Right. Why is it important to make every attempt to correct strabismus?
That's a good question. So basically, when a patient first develops strabismus, because their eyes are pointed in different directions, they'll often see double, because each eye is actually fixating on a different location in space. But over time, the brain ends up shutting off the image to the good eye. To the deviating eye. So the deviating eye ends up suppressing that image, basically. So patients will no longer see double because they're only using the eye that's pointed straight, and the eye that turns, the brain just stops taking information from that eye. This leads to less confusion from the brain, but it also leads to a reduction in other visual efficiency skills, as well as a reduction in binocularity, or the ability to use both eyes together. And then patients, as I mentioned, will also have issues with other visual skills, such as eye tracking and focusing as well. So it is something that we definitely want to correct in patients. A cosmetic factor is also important for patients as well. So people don't like the appearance of the eye turning in or out. So that's often the primary concern of parents or of patients, is to just get better alignment. So our goal when we do vision therapy is to improve alignment, but also to improve binocularity and visual skills. So it is very important to treat strabismus effectively.
Okay. And how effective is optometric vision therapy at treating strabismus?
Vision therapy can be really effective in treating strabismus for the right patients. So it is possible to get really good cosmetic alignment with vision therapy, as well as improved binocularity and improved efficiency of other visual skills as well. So that's always our goal of vision therapy, is to actually improve binocularity, so that not only do the eyes appear to be pointing straight ahead, but they are actually gathering information together, and the brain is using the information together. Patients often end up gaining more awareness of what their eyes are doing, and even what their body is doing as well. And the more aware they are of what their eye is doing, the easier it is to actually point it accurately at targets in space. So this is really important to achieve for patients. So there's also the possibility that if we do vision therapy, that we don't always achieve perfect cosmetic alignment. But the good news is if patients have undergone vision therapy prior to surgery, the outcome of surgery is often more successful as well, and it reduces the chance of requiring multiple surgeries to achieve alignment.
Okay. Can you tell us, Sarah, what activities and tools are used by the vision therapist in a therapy session?
For sure. So we often will start the early weeks of therapy with, just as I mentioned, providing the patient more awareness of their visual system. So we want them to be able to take in information from their periphery as well. So we'll do what we call a lot of peripheral awareness activities. We do a lot of gross body movement activities as well, so that they are more aware of where their body is positioned in space. Patients don't know how to point their eyes straight if they don't know where straight is in reference to their body. So they do really need to gain this awareness. That's a really critical aspect of doing vision therapy. As they start to develop these skills and we progress through therapy, we start to do more visual activities such as eye tracking and eye focusing activities as well. So there's multiple phases to therapy when we're treating strabismus.
Okay. Yeah. Do you assign exercises for patients to do at home between therapy sessions?
Yeah, we do for sure. So our therapy program consists of in-office sessions with our vision therapist. And these sessions are planned and supervised by the doctor as well. And they're customized for each patient depending on their diagnosis and what their visual requirements are. These sessions are typically 40 minutes and we'll go through and do various activities. Sometimes we'll spend teaching the homework activities, and sometimes we'll use some of the instruments that we have in the office that we can't send home with the patient. The home support activities are often critical for the success of vision therapy. So I always compare it to going to the gym. If you go to the gym once a week for 40 minutes, you're not going to see the same results as if you go home and do exercises in between those gym days as well. So we typically will send patients home anywhere from 15 to 30 minutes of exercise activities that they have to do at home as well to perfect those visual skills. If patients are unable to do the homework activities, so we do have some children where they don't have great attention, or families where they don't, their schedule doesn't allow for it. It's still possible to do vision therapy. It's just that the course of treatment can be significantly longer. So we do really encourage and expect patients to participate at least 5 days a week in the home support activities. It does really improve their chances of success with a vision therapy program.
Okay. And how long does it take for patients to start seeing improvements?
This can be really case dependent as well, depending on a variety of factors. Sometimes we'll see really good alignment in the early phases of therapy as patients just become more aware of where their eyes are positioned in space and kind of what they're doing. Other times it takes a little bit longer for patients if they have other factors going on that make it a little bit more complicated. Our typical session length for a patient with strabismus can be 36 to 48 weeks or longer, depending on the case. So it's, as I mentioned, it's very dependent. So we usually will prep patients by saying it's going to take at least 6 to 12 months of vision therapy to get good alignment and good improvement of those other visual skills.
Okay. And can surgery be avoided to treat strabismus in all cases?
Not necessarily. So surgery is not always avoided. We often see really good improvement in alignment and also binocularity as well, which is great. But there are still some patients where we just can't get complete alignment in them and they do require surgery. I don't want patients to be discouraged from doing vision therapy though, because even if they end up requiring surgery afterwards, the outcome of surgery is much higher if patients have done vision therapy first. So all of that hard work that they put in, becoming more aware of where their eye is pointing and what their eye is doing, it will help to achieve better alignment after surgery and reduce the chance of requiring additional surgeries as well. So even if patients are considering going the route of surgery, I do think it's really important for them to still consider doing vision therapy prior to doing surgery.
How can someone get started with Vision by Design for vision therapy?
So if we have an existing patient, then we'll often discuss the option of vision therapy during their routine eye exam. The assessment that we do for vision therapy is quite lengthy, so it ends up being about 60 to 90 minutes where we end up taking a number of additional measurements of various eye skills so that we know exactly what's deficient and what areas that we need to work on in a vision therapy program. So that is a separate appointment. We call these our vision rehabilitation or our visual efficiency assessments. So if a patient is interested in pursuing vision therapy, they do have to have an assessment first so that we know, what areas we need to work on. So they would just have to phone our office and talk to one of our staff members about vision therapy, and then one of our staff members can guide them onto the procedures for booking an appointment. So if they would like to do that, we don't book these appointments online because they do have to be booked very specifically in our schedule with specific doctors at specific times. So you would have to phone our office at 780-444-6407 if you're interested in scheduling a visual efficiency examination.
That sounds great.
Yeah. All right, thanks for joining us, everybody. I hope that gives a little bit of information on strabismus and vision therapy. We're really excited to provide this service in Edmonton. I think vision therapy is really important for patients with strabismus. If you like this information, feel free to subscribe to our channel. We'll see you next time.
Bye.